Hi everyone, I'm Fern Gilkerson here at PCADV, and again we have the pleasure of working with Becky Van Tassel from the Calgary Sexual Health Center on our special topic series of sexual consent and disabilities. I would like to invite you, if you're sitting near your hanging out or hooking up card and your Did You Know Your Relationship Affects Your Health card, to please pull those out for working with those for an exercise later. So I will go ahead and hand it on over to Becky. Thanks.
Hi, everybody. It's really nice to virtually see all of you this afternoon. Thanks for coming in. Today what we're going to be chatting about is moving beyond the birds and the bees, teaching sexual health education to adolescents with disabilities. So I am going to do things a little bit differently for this particular live discussion. So what I want to do is start off the same way we have in other days. I'll just remind folks who I am and why I'm sitting here in Canada chatting to all of you on the East Coast. And then I'm going to actually show you some of the tools that we use in our sexual health education, and perhaps use this as an opportunity to think about the type of sexual health education you're currently doing with adolescents, and things that you may be wanting to do to enhance or to increase inclusive practices for those folks with disabilities that you're seeing. So again, I work for Calgary Sexual Health Center. We've existed for about 44 years. We have a very comprehensive website, and I would recommend that you check that out at www.calgarysexualhealth.ca. I manage our professional development program, and so we've trained 25,000 professionals like yourself since 2009. And one of the major areas of our work that we do is working with folks with disabilities. So one of the things that you can check out on our YouTube page is actually a partnership we have with a group called Right to Love. Now, Right to Love is a disability advocacy group. And so it's a group of self-advocates that meet at our office, and we participate with them. And essentially, they're advocating for their right to love and talking about how folks with disabilities have not always had the same rights as other folks when it comes to sex and sexuality. And so all of our content really does come from the spirit of Right to Love. And so I'd really recommend that you check them out and check out some of their resources. Hi, Megan. I'm excited to see you. All right. So again, what we're doing today is we're looking at strategies and tools to modify your current practices. Maybe to take a little bit of time and consider how you're currently providing sexual health education and look at some universal teaching techniques that you might want to incorporate. I'm also going to deep dive a little bit more into the Circles program that we talked about and speak about how this can be a useful program to help us really talk about boundaries, really talk about social media safety, healthy relationships, and I definitely want to bring in your hooking up, hanging out cards into that conversation today. All right, so I thought that for this session, I'm going to start the session the same way that we do for all of our sexual health classes for folks with disabilities, just so you can kind of get a taste of the language that I use, the approach that we take, and maybe this will inspire, hi Fern, this will inspire other folks to kind of think about setting the stage for this. So one of the most important parts of teaching sexual health education, and I'm sure this goes for every single one of us in the room, is creating a safe and comfortable atmosphere. And so we do a very simple icebreaker with all of our groups where we go around and we tell each other what our name is and what we like. So my name is Becky, and I like my dog. The dog over to the right side is my little French bulldog, Olive, and the one beside her is actually her sister. So I'm hoping we could just go around quickly, and everybody could share their name and something that they like and they feel comfortable sharing. Fern, do you want to go first, just because I can see you?
Sure, I'm going to be a complete copycat, and my name is Fern, and I like my dog too. I don't have an amazing picture of him, but Shelby can testify to that he's a cutie.
He's adorable. He's a Yorkie.
Yeah, he's a Yorkie. So, yep.
Amazing. Does somebody else want to share who they are and what they like?
I can go next. This is Lexi. I'm sitting in the room with. So my name is Lexi, and I like the beach. So it's summertime. I am looking forward to a beach trip for sure, and wish it was sooner rather than later.
That's totally fair. Megan, my name is Megan, and I like to hike. That's excellent. Thank you, Megan. I also love hiking. And as most of you may not know, I actually live right next to the Rocky Mountains. So my little French bulldog has summited more mountains than a lot of humans have, actually. Who else hasn't gone yet? Caitlin? So some folks are choosing to use the chat, and that's totally okay. Please feel free to do that. If you want to, all of your mics should be unmuted, so you're welcome to just speak it out too.
Shelby,
how about you, Shelby?
My name is Shelby, and I like to fly kites.
Oh, that's excellent. That's so Caitlin's jumped in. My name is Caitlin, and I like to travel. Mary. My name is Mary, and I love cats. That is excellent. Amber. So sorry I got in late. I'm Amber, and I like going to Renaissance fairs. You are a very interesting group of human beings, I have to say. There's a few things that I've never had come up before in this activity. So this is wonderful. Thank you for participating in that. Like I said, we start all of our sessions off with folks just breaking the ice, getting comfortable, getting to know people. And there's a couple things you'll notice about my slide. So for example, in this little go-around, I used images, I used text, I used auditory, and sometimes we'll even pass things around as a cue to help people talk. And so what I'm doing in a very tiny way is displaying universal teaching practices, which we're going to get into a little bit more in this hour. So all of our sessions start from a place of talking about rights. And so again, we're really focusing on strength-based and plain language approaches. And so this is the slide that we start all of our sexual health education with folks with disabilities. But we use these same rights for every session. And as many of you have already heard in my sessions, these are the rights that we use. So the first thing I do is I go around and I say to folks, so we're going to talk about our rights. Anybody know what that means? What does it mean to have rights? And you're all welcome to type or to just share your thoughts out loud. So I wrote things that I can do, and Fern says, I'm free to do things I like to do without bothering or hurting others. I am protected by law. Caitlin, fundamental human rights. Excellent. So these are all really good examples, depending on the group, and really I think kind of where they're at. We talk about rights very similar in the way that Fern did. So I'm free to do the things I like without bothering or hurting others. And I agree with Caitlin and both with Fern. It's important to let people know these are their legal rights. So we start off by telling folks, you have the right to join in. You have the right to talk during the sex ed class. You have the right to ask questions, share your opinion. You also have the right to say no. You have the right to say, I don't want to do that activity, or I'm not ready to hear that information, and that's okay. The next thing I'll say is respect. We all have the right to respect. Now, what do we think respect means? What's an easier way, maybe, of describing respect? What is respect? You can type your responses, or you can just verbalize what you think it is.
I think it might be when you look at someone and see that, you see them with rights and that you are going to honor those rights, maybe to do what you to do.
Amber, I love what you said. So I love what both of you said. It's about respecting each other's rights. It's about treating people with kindness, empathy, and dignity. And so when I'm working with groups of students, both adolescents and adults, I talk about how we're going to be open to each other, we're going to be kind to each other, and we're going to really listen to each other. Yeah, you're right, Shelby. That's a really plain language way of discussing it, being polite, right? A lot of folks have been told what that means in their lives. Then we talk about privacy. So we all have the right to privacy when it comes to talking about our bodies, our health, our relationships. All of that should be private. But it's important to recognize that what I say to you, it's really not private information. I'm an educator. But what anybody else says in this room is going to stay in this room. And the last one is that we have the right to have fun. So I'm hoping that this discussion is going to be a really good time and really fun today. So that's the way that I really plain language our rights. What I do in the next level is talk about these in terms of sexual rights with people. And so I'll talk about how throughout this whole time together, you have the right to participate or pass, so to say yes or to say no. This is called choice. And then I write choice on the board. Every time we talk about anything like relationships, sex, birth control, pregnancy, we go back to that notion of choice. And a really important element of universal education is that we constantly repeat the same messages in different ways. So choice is a word that I really build heavily into my education. The other thing, too, is I'll talk about how within sexual relationships or relationships, they should be respectful. People should be kind to each other. They should listen to each other. And that folks do have privacy in order to, ask questions or to have private time with a partner. So what I would recommend is in whatever way that you're talking about sexual health education with groups of youth or with individual adolescents, that you consider how you can modify the way you talk about confidentiality, the way you talk about learning rights, to be quite plain languaged and accessible to all humans. So in our sexual health education with folks with disabilities, we do that very important introduction. Then we talk about what are relationships. So we do a brainstorm around the different kinds of relationships that people have in their lives. And then we talk about what is sexuality. What does that mean? How does that show up for people? What are the different types of sex? Then we talk about boundaries, really focusing on circles and consent. We go into pretty detailed information about bodies, because what I find is a lot of these adolescents and adults have actually never had any information about their bodies. And certainly that information hasn't been presented in a really positive way. There was a group I was working with a young man, and when we were talking about the penis, he referred to the penis as a no-no. It took 5 sessions to get him to refer to his penis as a penis. That's a pretty strong message, though. Somebody being told that parts of their genitals were actually considered the no-no. Then we talk about pregnancy, birth control, STIs, and gender and sexual diversity. So I'm curious, maybe you could all type in some of the different topics that you take up with adolescents that you're working with. So I'll give people a couple of seconds, and I'm just going to close my email because I can hear it going off. But just to type in some of the things that you're currently talking about in your own curriculum or in your own one-on-one interactions with adolescents. Okay, so Megan says, our coordinators present on safe touch, and special education classrooms and appropriate sexual behavior. That's awesome. So that's really, really great that you're having those conversations. I think that's a really excellent start to the conversation, and I love to hear that that's happening. Fern says it may not be that different. And I'm going to give away the secret right now. From our educational perspective, we actually teach the exact same topics to the, we don't use the term special education here, but we did used to, but to our classes where there are folks with developmental disabilities, because we believe that they have the exact same information needs as other folks. We just teach them in different ways. Mary says, difference between healthy and unhealthy relationships. the importance of leaving an unhealthy relationship and how to get out safely. That's awesome. I think that that's a really important part of comprehensive approaches to talking about relationships. Safety planning, that's great. What to do if they end up in a hard or unsafe situation. That's really, really excellent. So I just want to kind of throw a question out there. And I'm going to start off by saying there's not really any right answer. But what I do know from the research is that a lot of times when we teach sexual health classes to folks with developmental disabilities, we do typically focus on violence prevention. And that's great. There's a really good reason for that. We know that folks are at a disproportionate risk to experience violence in their lifetimes if they have a disability. But I want us to just think about the impact of that messaging. So if our messaging towards adolescents is mostly focused on violence prevention, what could potentially be the impact on those adolescents? So I'll give people time to either talk or type out what their thoughts might be. So a bunch of you are typing, that's great. So Megan has a really important point. Sex negative potential, associating sexuality with violence automatically. So Lexi has a really important piece. It may place blame or responsibility on them to keep themselves safe, absolutely. And that it's something that's bad, yeah. So a couple of years ago, I did a really focused research project where I worked with 7 different agencies to train them on how to talk about sexuality with their clients. I did sex ed in all 7 of those agencies, and then I also did training particularly with guardians. And one of the things that came up really strongly from the staff and also from the people, the folks with disabilities that we were teaching, was that they had commonly heard so many boundary conversations, those types of conversations, that it was really hard to actually talk about things from a healthy relationship perspective. And so what I would encourage folks to do is to really take some time, and we're going to do that today, but to think about your curriculums that you use in a comprehensive way, and how can those things be adapted to be presented to those same youth? Because I don't think the sexual health needs are actually all that different. All right. So I just want to chat a little bit about learning styles and learning strengths. And this little bit of information really helped me understand how we can modify our current curriculum and our current sex ed practices. So it's estimated that 60 to 70% of disabilities are not visually apparent, and that universal teaching techniques will actually benefit all of your students. So if 60 to 70% of disabilities aren't actually visible, what is the impact of that on us as educators and coordinators and administrators? What does that do in our practice? So take time to maybe think about a response or type one out. So if we're not working with the intention/attention to this, we miss the need for many students. So I think that's a really important piece for most of the time we actually don't know the disabilities of the folks in front of us. There's most, particularly developmental disabilities, are invisible. And so it is very easy to assume that if we're in a classroom where folks haven't been identified as having disabilities, we just teach our curriculum as it is. Or when we have folks coming to see us in clinic or coming to see us at the school, we just respond in a way that feels natural. But there's a really, I think, important element to paying attention to the fact that there's tons of folks there who might not be hearing the messages that we're giving in the same way. And so we may have to adopt or adapt some of our processes just to be that little bit more inclusive and aware of who potentially could be our audience. So what do we do when we're thinking about adapting curriculum? So the first thing that we did here, and a lot of this information came out of the additional resources that I sent you, but we start with thinking about the objective. So what's the objective of teaching sex ed? Why do we do that? What do we want to do for folks? to reduce the rates of unplanned pregnancy, STIs, and HIV? Absolutely. And what we know, research has really shown that a comprehensive approach to sexual health education is the best way to do that. To give information and to make decisions, absolutely. Great answer, Shelby. To empower people to enjoy their bodies and sexuality, to avoid the pitfalls. I love that answer. I think that's a really important piece of this. It's about empowerment and autonomy and being able to really be authentic to our sexual selves. But let's pick one of those objectives. So let's pick the objective to give people info to make decisions. And so, yeah, so you're totally right. Lexi, I think it's really important that we do this to be clear about the programming and the intention, right? So we're going to start with the objective, and let's say the objective, so we're very clear about our intention, is to empower people to enjoy their bodies and to escape pitfalls. So the next thing we would want to do is, how are we currently teaching this? So I think that that's a really important thing to think about. How are we teaching this particular process? What are the things that we're relying heavily on? So I want us to just take a minute, and regardless of which outcome you wrote down, I want you to kind of type, what is the way that you most likely are going to teach people? What are the things that you use? Got one person typing, that's great. Maybe I'm going to ask this actually in a slightly different way. A bunch of you are typing. Yeah, we tell them. That's absolutely it, Shelby. Oftentimes we use verbal stuff. So I'm going to, if we could use our little hands up. So if people here use a lot of verbal, like language-based stuff in their teaching, go ahead and use the thumbs up or the hands up little sign. Yeah, a lot of folks are raising their hands to that. That makes a lot of sense. Amber has a really excellent point. So hands-on examples, so the contraception where you can actually touch it, visuals with the anatomy, and then the walk-through steps, so condom lineup, for example. That's a really neat activity. We do the same one, and we've actually added in little pieces so that we can actually talk about consent at the same time. So where does consent come in when you're putting on a condom, and where should that come up, and things like that. So what Amber has really brought up, I think, that's important to know is that she's incorporating a variety of different teaching methods. So I want us to, maybe take some time after this call to think about our current teaching. What's our objective, and what's the objective that you have put out by the health resource centers? And then what are your kind of things that you typically do? And then kind of taking up what Amber is saying, how can you ensure that in each of your activities, you're incorporating visuals, tactile, and auditory activities in order to best meet the needs of all of the youth? And like we discussed last time, putting a lens of plain language on top of that. So here's some of the tips, and what we used is, again, focusing on plain language. It's really important to, we're pretty technology heavy with our work with adolescents with disabilities, because it's one of the few more community-based programs where we always try to have a visual or a slide. Social stories are a really interesting and excellent way to talk about some health outcomes that we may want to address. You can actually Google social stories for autism and sexuality, and there's a wide variety of examples that have already been made. If you're going to show videos, ensure that there's always closed captioning on those videos, and make sure that you're providing handouts to students, particularly ones that will work with screen readers, so that folks can follow along. I try really hard to ask folks about how they best like to learn. Using repetition is one of the most important things that we can do, I believe, with all human beings and in all learning environments. but particularly those folks with disabilities. We're not going to have a conversation once. We're actually going to try to have the conversation time and time again as much as possible. And if you're working in a school, it's really great if you can work with the teachers to go in, do some sex ed in the class, and then be that same person that they can connect with at the school. That also really helps with repetition. Scaffolding is a really important concept. So we do scaffolding with the rights. So we'll go over the rights really clearly at the first session, the second, third, fourth, fifth. And anytime we talk about consent, we go to the rights. Anytime we talk about birth control, we go to the rights. So scaffolding it's exactly what it sounds like. You're building on top of concepts that have already been there. And provide students with handouts and pamphlets in advance of the session. We encourage folks to look at these with their guardians or their parents. That can start an interesting line of communication. And I would say the cards that you have, and I know that many of you have brought them onto the call, the hanging out, hooking up cards could be a really great resource that you're giving to folks in advance, and then you're revisiting those. So I asked Fern, because she's more familiar with the cards than me, maybe just to provide a couple of examples of ways in which you could use the cards to talk about some of these topics in a way that might be a little bit more inclusive and friendly. Fern, we can't hear you.
In the beginning of the webinar, I had kind of prompted folks to get copies of their cards out, and if you don't have them out, that's okay. But, you know, in looking at how to deliver the card language with plain language, if we look at the Did You Know Your Relationship Affects Your Health card, one example might be in the first panel where it says, is my partner kind to me and respectful of my choices? And that's under the topic heading, are you in a healthy relationship? A plain language delivery of that might be, is my partner kind and respectful in your conversation, and kind of prompting them to think about this, that the adolescents that you're working with. Or that could even be broken down further into two questions. You could talk to them about considering, is my partner kind? And then move into considering with them, is my partner respectful? And then going back to something that Becky did earlier, which is really exploring maybe what respectful means to them. Another panel on this particular card might be the Taking Control panel, which has a lot of words on it. It might not be that appealing, you know, especially if you're working with someone with disabilities. And, you know, if it comes up that someone might be, as it says on here, messing with birth control might be unclear, as it could have multiple meanings. So a plain language interpretation or delivery of that might be that, you know, you can talk to your provider about birth control that can't be changed or taken. So instead of saying messed with, you might say changed or taken. That seems to be a bit more of a direct and plain language way to say messed with. Becky, do you have anything to add to that one?
I think that was great.
Switch over? Okay. So then if we look at the hanging out or hooking up card, and we want to consider how we can verbally deliver this in more plain language ways, we can look at the panel. It's the second panel on the card, and it's titled, And on a Bad Day. And the prompt says, pressure you to go to the next step when you are not ready. So that could just be simplified to say pressure you for sex. I think that's a pretty clear and direct way to say the same thing maybe. Another panel on the hanging out or hooking up card could be the everybody text panel, which is right below the bad day panel. And while we, you know, do kind of think that this card is a little more plain language and a little more accessible with different reading levels and learning abilities, you know, there are some wordy parts to it, which is why we kind of honed in on the everybody text panel, which is the second paragraph. You know, if someone comes up with talking about the text that they're receiving and what someone's asking them to do, this could really be simplified to say, it can be hard to know what to say. You could try. I don't like it when you text me or ask me for nude pics. So that's a really simplified way to say, you know, kind of what's 4 lines here. You can cut that pretty much in half and really, you know, be much more clear and straightforward with the question. So I think that, you know, this natural paraphrasing, the more that you work with the cards and the more that you begin to get used to them, I think it'll come more naturally. I don't know, Becky?
No, I think that's great, and I really appreciate that a lot, Fern.
Yeah.
What I would like to do is remember to always work with strengths. This is going to be the one that comes up constantly in my discussion. But I would like to have folks maybe populate a line or two of examples where they might be working with some of the adolescents and boundaries have come up as a challenge. Because what I would like to do is expand. I know in our webinar we really talked about circles very briefly, but I would like to give you an opportunity to share some of the experiences that you're having with adolescents and where boundaries are coming up as a challenge, and then we can use that to talk about how we would use circles and the cards together to provide a really, I think, supportive and more positive way of talking about healthy relationships and boundaries. So I'm going to give people just 30 seconds if they can think of a situation where boundaries are coming up for the adolescents that they work with. If you want to just type that in. Probably the most common situation that I've dealt with as an educator. So when self-touch is appropriate, instances of students masturbating in the classrooms or hallways. So this is awesome. Lexi says using a hula hoop to teach personal space. That makes sense. So we can chat about that a little bit more. I love Megan's example. I'm going to see if anybody has any other pieces, but I'm certainly going to use circles to talk about that. Physical space. Always have to have the bathroom door open. Interesting. Okay, so I can actually touch on those kind of pieces. I think I'm just going to kind of clarify with Shelby a little bit. Sometimes I've worked with folks who've actually been told that they need to have the bathroom door open, need to have the bathroom door closed. Yeah, so I think that that's a fair thing. A lot of times I think it can get complicated for people because maybe they have aides who need to be in there with them. Maybe they actually want the door closed, but they do need to have somebody helping them. And so we can chat a little bit about that. So I'm going to go straight into the masturbation question because it is literally the most common thing. So we're going to go back to circles. And we're going to start really looking at circles in a big picture kind of way. So we start with the purple circle, which is me. So we really kind of have 3 touchstones here. And the important piece is to not focus on the no, but on the possibilities of the yes. So touch, talk, trust. So with yourself, you have full right, so you can say yes or to say no to whoever touches you. You get to decide who to talk to, and you totally get to trust yourself. You know yourself. When it comes to touch, you have the right to touch your body, including your penis, your vulva, vagina, however you like to refer to your genitals. That is your body. But where are the okay places to do this? There's nothing wrong with touching your body, but that has to be done in a private space. So I would like for people right now to type in what would be examples of private spaces that we would provide this youth. Bedroom, great. A bunch of people are typing. Bathroom, that's a good one. We always try to establish that more. So like a bathroom with one stall with a locking and closing door. Not the urinal at the school. Your home when no one else is home. Sure, as long as you're in a place where you have privacy. So being in the kitchen might not be super private. Treehouse, if you're the only one there, that's great, Mary. So I think if someone said treehouse and you're alone, I would say that sounds pretty private, but probably what would be more private is in your bedroom with the door closed. That being said, though, both you, Amber and Mary, I think you could be touching on adolescents who actually have been told they're not allowed to masturbate in the house, and so they might be trying to find spaces that feel safe to them. So I would probably just be, in very plain and clear language, talk about specifically private spaces are places where the door can close and lock, places where you're alone, and places where you don't have an iPad, an iPhone, a computer, or something like that with you. That's the other thing. So if there's a student who's masturbating in the hallway, we really do see this a lot. What we've done is we've actually gone over circles with them and have really identified where those okay spaces are to do it. We never shame the student, so we tell them it's okay, it's normal, it's natural. We also have cards with pictures of a lock and a key and kind of like in a bedroom to help people recognize that. If you have nonverbal youth who are masturbating in public, there's a really great resource made. It's a Canadian resource by David Hinsberger, and it's a masturbation video. It actually teaches people how to masturbate safely. The trick with them is it's quite explicit, so you would probably actually need a guardian to purchase that video. But it can be useful if you have folks who are nonverbal that might be injuring themselves during masturbation. So Fern says, would you have the same conversations with students who have sex with others in the halls, on the bus, or in other public places? Yes, but I would take it to the second level. So I love that you're like, I feel like I paid you, Fern, to ask that. So we, of course, start with the me, and then the next place we're going to want to go is the blue hug. So we talked about this. So this is family touch, right? Family, you would have non-romantic hugs and kisses. Talking, you would probably talk about most things with your family, and you would have full trust with them. But the special kind of piece here is the sweetheart circle. So this could be the person that you're romantic with. So as you see, you are in the circle, the me. You have most trust with yourself. And then you have the family circle, which is very, very close to you. But you also have the separate sweetheart circle, which kind of moves in a little bit into your own personal space with a high level of trust. So what we would talk about with the sweetheart is romantic touch. So what is romantic touch? It would be, touch that is like making out, like on TV. We oftentimes will show different types of, couples and sexual types of embraces. For some students, we might get a little bit more detailed about what that would mean. And so we're really clear that it's your choice. Again, going back to those rights, if you say yes and your partner says yes, then you might have romantic touch with this person. You would probably trust them a lot, and you would talk about most things with them. So a person who is in your sweetheart circle, you would be able to talk about your body. You would be able to talk about your feelings. You would be able to talk about, if you want to say yes or to say no. And again, you would have a high level of trust with this person. So what I would say is for folks who are maybe hooking up with other folks in the halls or on the bus, is we would go back to that privacy piece. So while it's okay if you're both consenting and you're both comfortable to be engaging in those behaviors, it's actually not a private space. And so those behaviors are fine as long as they're in private, and then helping students identify where those may be. It's highly likely that adolescents actually won't have access to private spaces to be doing these types of things, but we also want to make sure that they understand that if you are doing this in public, the kind of, ramifications that could have, like you could get in trouble with the teacher, it's not really safe to be doing that on a bus, those types of, specific pieces. But yes, a very long answer to your good question, Fern, would be you would really talk about, private versus public and what that means to people. So Fern's typing more. How can adults in the school environment work together to address this in an appropriate way? That's excellent. So actually in my fourth live chat discussion, I'm going to be providing some communication tools that I would love for folks to share widely with all sorts of humans. The most important thing to me is that we never shame these students. So all staff need to know they have the permission to have conversations, but it should always be done in a positive and respectful way. So affirming to students that, yeah, this might feel good and they might be happy and maybe legally they're actually of age to consent to this. But that, from a united front, there's places where it's okay to do this and places where they actually can't, like public. So we will be covering that. But again, the biggest thing for me always is to never re-shame people. Well, if you wanted to and you had time, I really do get into the idea of, those other social relationships. So in your green faraway hug could be extended family. It could be very, very close friends. So we talk about, that kind of junior high school dancing. I don't know if anybody remembers that sort of touch, but that would be an appropriate type of touch. This is where the idea of kind of the hula hoop came in. This would probably be a great place to talk about the hula hoop. You would share some personal news, but you probably wouldn't talk to them about everything, right? And there would be a lot of trust, but not the same amount of trust that you would have with, say, your parents or sweethearts. This one I think is important for staff to really talk about. So the neighbors and acquaintances, as the kind of handshake, fist pump, you would make polite small talk, you wouldn't tell people personal things, and you probably wouldn't trust these people a lot. Sometimes I see adolescents who meet someone in their neighborhood, they talk to them sometimes, and immediately they tell me that now they're their sweetheart. They would probably use different terms than sweetheart. But what they've done is they've actually jumped quite a few spaces, quite a few different levels in that circles map. And so a really affirming way of talking about that would be, you probably need to develop more trust over time. And so you wouldn't trust somebody that you would only shake hands with or that you've really only met once or twice the same way you would your parents. And to kind of look at that in that global way. Orange wave circle, we're definitely looking at, waving and smiling and nodding. These would be folks that maybe we see on the bus, short answers. You don't have a lot of trust in these folks. And then finally, red stranger circle, right? So, talking about you don't want to really be touching these people. You don't really trust them, that type of thing. Now, where I think this all gets really interesting, we're going to use a show of hands. How many of the adolescents that you work with use social media? How many of the adolescents that you know have disabilities use social media? If you say you have some adolescents who are, you can do the little check mark. So we got one check mark. How about have access to technology, like iPads, phones, things like that? So what I'm seeing a lot of is folks are meeting people online, and that's totally okay, right? There's nothing wrong with meeting folks online, but where it's getting confusing is that people are seeing folks in the red circle, stranger circle, and then assuming them to be really great friends right away. So we're seeing folks, who are getting friends on Facebook, Snapchat, et cetera, and placing them in a much closer circle than they actually are. And so this tool can be really good for internet and media safety as well, just to talk about, if you've just met somebody, they probably actually don't fall into your sweetheart circle. That takes time. You have to get to know them. The other place that this is really helpful is if you are finding that some of the adolescents are maybe developing crushes on coordinators, maybe expressing a romantic interest towards staff that might be super appropriate, is you can then go back to where staff sit on this, which is typically in the yellow handshake circle. So, you trust that person, it's okay to be around them in a professional context, but you would never have the same level of talk, trust, and touch as you would if you were a sweetheart. And so this can be really helpful, I think, to navigate some of those complex pieces. I have one person just typing, so I'll wait to see what they have to say. Oh, yeah. So Caitlin said, do you find that this circle method works with youth with particular disabilities over others? Yes. This tool isn't going to be effective for all youth. I think it does work really well, certainly for certain folks. What can be really good about circles is that you can shrink it down and have youth actually carry it around with them as a reminder. So support staff can use it. Circles actually works best if the special education teachers are also using it in their classroom because, again, it's like scaffolding on knowledge that currently exists. I find that there are some youth who this just isn't going to work for, and that's totally okay, right? There's other methods and approaches. It's really about finding the strengths for that particular person. By and large, though, we found circles to be pretty effective, at least in having those like basic kind of conversations, and they're really helpful, I think, in starting the conversation. That being said, though, I've also seen circles used in kind of a negative way, where people will say like, oh, if a stranger, you can, got to be afraid of that person and you can't ever talk to them. The message is never about fear. It's about somebody could meet as strangers and over a period of time get to know each other and eventually become sweethearts. Right? So I think that's a really, really great question, Caitlin. A couple other people are typing. While we wait for the folks who are typing, maybe some questions or some thoughts, I'm curious, and be really honest, do you think that circles could be adapted to be used within your programming? And if you think so, or you don't think so, maybe just type out a little message to how this could be potentially included. And Amber has raised their hand. That's great. I'm assuming that means that it could potentially be adapted. Ah, excellent. Thanks, Amber. So I love this. What do you say when they ask why I can't be romantic with my teacher? That's great. So I would say, well, where do you think your teacher fits on the circle scale? What would be an appropriate type of touch, of trust, of talk? And they might say, but I really like them. And you could say, yeah, they like you too, but it's not the same. Remember that romantic touch is different. And you may even want to show a picture again of what that looks like. And, just stressing, for a teacher, they're never going to move into that particular circle. So that was a great question, Shelby. Fern says, it seems like the circle tool may be also helpful in working with neurotypical youth. This might also bring more community sense to the universalization of healthy relationships. So I actually have used this with neurotypical youth, with students in, kind of general classes. And we actually use this when we talk about natural supports. And, who are the healthy folks in our lives that we can be going to get more information, to get assistance, helping youth recognize that there are lots of folks in their lives. One kind of side piece, too, for coordinators who are doing one-on-one work, the circles map can be an excellent assessment tool to see who is in people's lives, where are the strengths, and who could you potentially be connecting with, to help support that adolescent. All right. So there's been some questions. I don't know if anybody would like to grab the mic for a minute or maybe chat in another question about the content today. I'll give you a minute to do that, and I'll let you know what we're doing on our next live discussion and the one following. So on our next session, which will be June 8th, we're really honing in on how to talk to guardians, how to work with natural supports, and then we're also going to look at advocating with other systems. So what are some of the tools and techniques that a person could potentially use? There will be a pre-reading resource for that one as well. And then in our final session, we're going to be doing some very practical, again, kind of information about answering questions and just getting the resources out there. So it's like the second half of how to teach sexuality and sexual health to youth with developmental disabilities or disabilities in general. The Circles program, you can actually see the curriculum and the information right there on how to access it. David Hinsberger has done quite a few resources. Again, David Hinsberger is the person who created the masturbation videos. I'm actually going to go back. So this Sexuality and Relationship Education for Children and Adolescents with Autism Spectrum Disorders is a really, really good book. They have full lesson plans and handouts that we've been using. And, oh, that's too bad that those aren't working. I can likely send them to you again. Probably, too, if you just copy and, like, paste them, you'll be able to get it. Sexuality, sex and disability is a really interesting, kind of more academic look at our construction of sexuality and disability, and I think it's just a really interesting read. And so, you're all welcome to contact me if you would like any more information or resources. I'd be totally interested in doing that. And I will be continuing to do some more work with your project for the next couple weeks. So that's kind of it